So fat grafting is a procedure where we're taking fat from one part of the body, most commonly the belly or the flank or the thighs, and then we take that fat and we wash it and we get very purified fat, and then we can place that fat into different parts of the body. And the most common locations tend to be the face, so almost every facelift I'll do fat grafting with that, and that's very important because with facial aging, that's one of the big drivers of aging, is that loss of those fat compartments in your face. And I always joke with my patients, they lose fat here and they put it here as they get older. And so a lot of patients will come in and they'll ask about the volume in their face, and my wife, who's Dr. Jennifer Janiga, who's a board certified dermatologist, will talk to them about filler or Sculptra, but at a certain point you actually need more volume than that. And so using their own tissue, using their own fat, you can put a lot of volume in the face, and not only does fat add volume, but it has a lot of growth factors in there, and it can really help improve the quality of the skin. I can also fat graft into the breast, we can fat graft the backs of the hands, we can do butts, we fat graft in a lot of different places on the body. And so as we age, we lose that subcutaneous fat. And so in the breast, we can fat graft young women who want a slightly fuller breast, we can fat graft older women who want more volume or have had reconstructive type of procedures. In the body, the procedure where we fat graft into the butt is what's called the Brazilian buttock lift. And with that, you're removing fat with liposuction. Again, you're washing it, and then you're putting fat into the buttocks to add more volume and give the patient a better shape.